United Kingdom's Prime Minister Keir Starmer has abolished the quasi-autonomous body that oversees the activities of the public health system in England. The move will bring the NHS England back under the direct control of the UK Health Department. Take a look.
Today I can announce we're going to cut bureaucracy across the state, focus government on the priorities of working people, shift money to the front line. So I'm bringing management of the NHS back into democratic control by abolishing the arm's-length body NHS England. That will put the NHS back at the heart of government where it belongs, freeing it to focus on patients, less bureaucracy, with more money for nurses, an NHS refocused on cutting waiting times at your hospital.
A bold move from Prime Minister Starmer. He's declared he will abolish NHS England. That's a body set up by the Conservative government back in 2012 to oversee health services. The government will now get rid of this middleman, so to speak, to gain direct control over health services under the NHS, the National Health Service. NHS England is not the NHS itself, and that stays, of course. This is the public body that was created to oversee and to manage that health service. And of course, this body covers only England, one of the 4 provinces of Britain. The other 3, Scotland, Wales and Northern Ireland, will take their own decisions on healthcare and health policy. The move now seeks to answer a lot of concerns and demands that have been rising, made by doctors and health professionals, and these have been really causing some concern to the public and to the government. And under this present system, NHS trusts overseen by NHS England have appointed layers of officials and managers that doctors say do not understand their needs and take decisions that are not in the best interests of healthcare. They want decisions taken in line with what doctors want rather than what the present lot of managers think they should want. And this move now seeks to place those final decisions in the hands of government officials rather than the bureaucracy of NHS England. But of course, whether the new bureaucracy will take better decisions is not certain, but this move clearly is intended in that direction. The decision is in line with a campaign promise to reform the NHS, always a major election issue, and no doubt the decision borrows from the mood across the Atlantic, as so often with Britain, to take bold and even disruptive decisions intended for the public good.
Sanjay, many thanks for joining us.